Hi, my name is Rob Nassar. I'm with ACO Health Solutions. We're a Nashville-based company that has supported the ACO industry since the pioneer ACOs were established in mid-2012. Our company provides patient attribution management solutions for over 24 ACOs, which includes mailings, online portals, address discovery, and we also provide other services such as performance reporting and benchmarking, our GPRO Audit solution, which I'll show you in a few minutes, Quality Registry, which is our year-round quality measuring program, ad hoc clinical reporting, and our bundled payment solutions. During this demonstration, I'm going to point out a number of different features, including our solution that has unlimited user login or user access, the ability to start the GPRO audit early, as early as 2 weeks before their scheduled time frame, our ability to import data, claims data, and EMR data from a number of different EMR systems to be able to pre-populate the data, and I'll point out where I can show you that information and where that will be indicated by your auditors, which will help your ACO become more efficient and effective during the GPRO audit. Our GPRO solution is an online-based tool through a secure web browser that can be viewed over any web solution, including Firefox, Chrome, Internet Explorer, which is what I have up now. We also have various other system enhancements, which includes our custom workflows that I'm going to be able to point out during this demonstration, online reference manuals, our data matching process, which helps for redundancy of sample set of data, PCP mapping, which allows our ability to map to your organizational structure, any of your claims data or your data sample set. What you're seeing right now is our base view that shows our initial dashboard, shows the distribution of your 3,000 to 4,000 patient sample set. We have sectioned off our test instance of our environment into 4 or 5 different groups, and we can obviously do that at an IPA level or at a larger level. This is the IPA level, shows that we have Eastern group and a Central group and Western. We also can, this is the ACO administrative view. You can use your unlimited user licenses to provide practice level views, so you can be able to go in, and if you're an Aberdeen GPRO user, all you would see is basically this view right here and nothing below, and you basically have the same view from the GPRO audit as you would at the ACO. Obviously it's one big practice level location, and you can obviously look to see your module progress and how you can distribute the data. But for this demonstration, I'm going to go back to the ACO view because it basically shows you the same level of functionality. The module progress view is something that even the QualityNet system itself does not provide for you. It allows you to see your progress that relates to each of the metrics. If you notice that QualityNet does not provide you this information until all your patients have been properly audited. But in this view, we can show that we had a sample set of 608 patients, and obviously this particular test instance, we all went through them and were able to consecutively complete them. But in other views, like coronary artery disease here, we had 47 skipped, and the reason why they were skipped, they were not confirmed. Again, you won't see this until the very end of your audit for CMS, and this is an important measurement to see if your auditors are skipping various metrics at any particular time. We have 4 different workflow buckets that you'll operate in. All your sample set of patients will be shown in the pending bucket. Now, again, this is our test instance, so most of our sample set have already been placed in the last bucket, which is called CMS validated. But in this view, you can see that we have all the patients listed. It shows the provider location, what the IPA pod location was, and more importantly, where their metrics are. And this is ranked by the CMS audit, CMS himself. When you're in pending, you go into the pending screen, and if you're at the ACO level or at the practice levels, you'll see which are the patients at the highest rank, because they want you to work on this based on the highest rank is shown. So right now we only have 3 customers or 3 patients that are shown in this view. We have one set up that has almost all the modules shown at the above. So I'm going to go into this one here, and you'll be able to see the information for Jerome Smith. Right off the bat, you're able to qualify the patient, and and show that if you can find the record, yes, move forward. If you say no and you say save and next, it will basically place it into the complete bucket and you'll be done with this particular patient. If you qualify the patient and it says the patient appears qualified, obviously you can move forward to the other modules that are shown below. If you did not, it would also, of course, place it in complete, and we would upload that into CMS. More importantly, when you're in each of the modules, they would show up here, and this is the pre-populated information. Right now, we have updated this information. We've changed the data that shows here. So right now, the screen shows chart audit. But if this data was placed in there and we have not touched it, this would show from CMS itself, because this is one of the data fields that are pre-populated. We also show progress by for each of the metrics with a green highlight around each of the modules that are collapsed and shown here. We also measure progress at the view that's shown here. I'll have to open my browser up a little bit wider here. And it shows that we're at 50%, meaning that 50% of the modules or the metrics that have been looked at have been updated. The other enhancement that we have within our system is that if you have a metric that is already being looked at or calculated within multiple metrics, and I'll show you one here in a second, it will get captured and moved into that other section. So if you have a blood pressure area, and we were able to feed it in from the EMR, which we can. This would show EMR, and we were able to look at that, confirm that this is the right information, and this would show up, of course, in the other modules that also rely on blood pressure medication. And that's the benefit of our tool. It allows you to effectively go through the audit process, perform and double-check the information by patient, and move forward with that. And then, of course, at the end of the audit, you have the ability to either mark pending, which means that you want to go back to it and still monitor it or make edits to it. You can mark for follow-up, which means that you have someone at the administrative level look at the information. And then you, of course, can mark it complete, which allows us to pick it up and place it into the CMS system and make sure it's validated to show the full life cycle of each patient record. One of the things that I probably failed to show you before is that we have a productivity measurement tool that shows how you perform the audit all the way through the process. So I'm going to show you this from the screenshot that we have from last year. This shows the progress all the way up to the maximum number through the process all the way to February 2014. This can show you by day audits being completed, and of course the incremental markup to your 3,000 to 4,000 count. The other thing that our tool does, besides measuring and tracking performance, is to be able to show you how you're performing by each metrics. And for second-year ACOs, this becomes essential because you want to make sure that you meet your quality points for the year. This shows last year's performance, but this chart would be pre-populated for the 2014 program year and developed as you complete your audit. You can drill down in this view and see how each of your IPAs performed at their level, more importantly your practice level, and then of course next level is your physician level. And so this is our test system. Some of the areas will be blank for this particular one, and then you can even show it down to your patient level. You can move this information in and out of this view so that you can be able to show this screen in a more effective manner. Any other view that is shown in this screen, you can download it to Excel, and that's another value-added tool. And most of our other views that we have allows you to do the same. This particular performance view is very valuable for any ACOs that are trying to monitor performance. It also allows you to avoid surprises towards the end of each audit. It's configurable. You can move and drop some of these data points into another area and avoid having too much data or too less data. And then you can also filter on some of the information based upon various other views and filters. And that goes the same for any of the table formats that you come across within our system. Our system has been priced to be highly effective in the way of giving you the tool quickly, allowing your ACO to effectively use it, and to ensure that you see max value. We also have other tools that allow you to do this type of function throughout the year, And I welcome any questions that you might have regarding this solution or any of our other solutions. Again, my name is Rob Nassari, and I can be reached at 615-305-8448, or my email address is R as in Robert, Nassari, N as in Nancy, ESSARI, at ACOHealthSolutions.com. That's Rob, R-O-B, Nassari, at ACOHealthSolutions.com. Thank you, and I appreciate your time. I look forward to hearing from you soon.